FLT3 maintenance therapy, yeah, this is one of the controversial areas of the incorporation of FLT3 inhibitors into acute myeloid leukemia treatment. At the moment, we have national approval in the UK for the addition of midostaurin, the first generation FLT3 inhibitor, to standard intensive chemotherapy based on the results of the international RATIFY study. In that study, patients were permitted to get midostaurin as maintenance after completion of treatment, but very few patients actually received midostaurin following transplant. And so the drug approvals for midostaurin have just been for patients completing chemotherapy but not following transplant. There is a large body of opinion that FLT3 maintenance treatment does potentially help patients who've gone through induction and consolidation chemotherapy and then had an allogeneic stem cell transplant, but there is relatively little clinical trial evidence to support that at the moment. So there are some important clinical trials that are underway looking into that issue at the moment. One very potentially important study that reported at the ASH meeting in the US late last year was a study run by the German-Austrian transplant group where they did a randomised assessment of the first generation FLT3 inhibitor sorafenib as maintenance therapy in patients who'd had FLT3 positive disease and had a transplant. And in a relatively small study, they actually demonstrated a significant reduction in relapse rate and also better overall survival in patients who'd had sorafenib post-transplant. It is a drug we're sometimes able to access in the UK, but there aren't any formal approvals in place for sorafenib. Another important question is whether any of the new second generation FLT3 inhibitors could offer the same benefit or more benefit than a first generation inhibitor like sorafenib. And there's a big international study currently underway called the MORPHO study looking at the drug gilteritinib as post-transplant maintenance. That study, I understand, is coming towards the end of recruitment internationally and is going to be able to give us some probably definitive results in the area of FLT3 maintenance treatment over the next 2 to 3 years. For now, though, it's very much an individual case-by-case decision whether clinicians are able to access maintenance therapy. And unfortunately, I think it's probably something that varies tremendously from patient to patient around the UK at the moment.